London EAU 2026. This is Francesco Del Giudice from Sapienza University of Rome, a current research and previous bladder cancer fellow at Guy's and St. Thomas's NHS. And more than happy to introduce my very close mentor, Professor Khan.
So I'm a professor of urology at Guy's and St. Thomas's Hospital, London, and King's College, London. So I have been involved in the fellowship training along with two of my colleagues, Ramesh Raja and Rajesh Nair, since 2015 when we established the fellowship program, which is actually recognized by the Royal College of Surgeons of England and also British Association of Urological Surgeons. So far we have trained 12 fellows according to this program and from 7 different countries. So this program is basically overseen by the Royal College of Surgeons for the quality assurance, and myself and 2 of my colleagues, we supervise all the fellows who have been going through the program for the last 10 years. We are very lucky to have very eminent fellows who are in different academic positions in different institutions, and Francesco is one of the fellows who has gone back to Italy as associate professor of urology in one of the Italian universities.
Well, very good. So let me do the provoker at this point, Prof. And as one of the latest fellow in bladder cancer, we are at the European Conference of Urology, where I think the point of the training is a must that we have to face. Have been once again the latest one, so I'm very fresh in this experience, which definitely changed my life. A quick question: how did you decide to start a program, and how in 2026 a fellowship training program is essential for the new youngling urologist?
Well, we were fortunate enough to start the robotic program back in 2004, 2003. It was one of my colleagues, Prokar Dasgupta, who doesn't need any introduction, myself, and one of our other friends from Eastbourne Hospital. So we started the robotic program. We were first in the UK to start that. And in 2005, we realized our volume was increasing and we could start the fellowship program in prostate. Bladder at that time, volume was not high. So we initially started with prostate, and then back in 2015, when our volume picked up in bladder cancer as well, we decided to start the fellowship in bladder cancer. The fellowship, I think we are very fortunate that we have 3 trainers in urology who are interested in the bladder cancer, and also we have collaboration with the colorectal and gynecological surgeons, because as a bladder cancer fellow, you don't necessarily just have expertise in bladder robotic, but also in the open surgery as well, so that by the end of your fellowship training, you are a complete bladder cancer surgeon. You also need to have infrastructure whereby you have bedside assistants, and we are very fortunate to have 5 bladder cancer bedside assistants, and as a consequence, our fellows get full-time exposure on the robotic platform. They don't have to start with the assistant and then come to the console, so they get the maximum console time. So by the end of the year, we are very proud to say that our fellows are really ready for independent practice.
Very good. So I think I will leave you with another additional question, and this is an international program, and ERUS has developed a curriculum structured for the training in radical cystectomy and intracorporeal diversion, which is probably the most demanding and challenging part, even the more risky perioperatively for the patients. How do you believe the philosophy at Guy's in terms of modular training has reflected and can interact with the current ERUS guidelines on cystectomy?
So bladder cancer usually happens in patients with a lot of comorbidities, and therefore and secondly, the radical cystectomy with diversion is one of the most complex operations we do in uro-oncology. And therefore, if whoever the fellow we appoint, if they have some experience, previous experience in robotics, it helps them to start well. But if they have not much experience before, then we start with the modular fashion according to the ERUS curriculum. And I think within 3 months, I think we have enough volume that by the 3 months stage, they are more or less independently able to do a full cystectomy and also intracorporeal ileal conduit diversion.
This is good. And for myself, once again, we will be presenting the data about the 10 years fellowship outcomes that we have been collecting over my year as a research project. It will be held on Monday. We will be more than happy to have you visit and re-look at the session. We will be going throughout the several points of the steps, what is needed for whoever who's come from, with less experience, more experience. We will review all the process of the training, which really change your life, as Prof mentioned, not only technically skills, but also, your environment as a full spectrum urology dedicated to bladder cancer. One very nice point to the survey that we let circulated to our fellows has been related about how the fellows' trajectories, careers after the fellowship remain within the bladder cancer field, which sometimes can, be not exactly sure, but this is really probably one of the most, I think, successful point of this kind of training.